Greetings, everybody. This is Mahmoud Ibrahim, and today we are going to talk about management of adolescent idiopathic scoliosis. So, first of all, I would like to talk about the definition of adolescent idiopathic
من فضلكم لو
scoliosis.
سمحتوا يا جماعة الهدوء لو سمحتوا الهدوء من فضلكم عشان نستمع للمحاضرة. فضلكم كله يلتزم مكانه. الهدوء لو سمحتوا.
Adolescent idiopathic scoliosis is a complex three-dimensional deformity, which means that we have in the frontal plane a lateral bending of more than 10 degrees. In the sagittal plane, we have flattening of the spine, and in the horizontal plane, we have rotation of the vertebrae. So this is important in assessment and treatment of adolescent idiopathic scoliosis. When we check the patient physically, we see a flat back, so there is absence of normal thoracic kyphosis and normal lumbar lordosis. And in some severe cases, on the left picture, we have a hyperlordosis in the thoracic curve. As we see in the X-ray, we have a flat spine. The thoracic kyphosis is below 10 degrees and lumbar lordosis is below 20 degrees. So, as it's a flat spine, we should not do these exercises. Hanging from a wall bar is a common mistake we use in treating adolescent idiopathic scoliosis because they are not kyphotic. They have a flat spine already, and we are encouraging flat spine with these positions. From the frontal plane, we use TRACE. TRACE is a trunk aesthetic clinical evaluation. It's a rank from 0 to 12. 0 means no deformity or no cosmetic deformity, and 12 means a severe cosmetic or aesthetic deformity. TRACE is divided into 4 segments. First, shoulder asymmetry. 1 means mild asymmetry of the shoulder, and 3 means severe asymmetry. Then the hemithorax. Hemithorax means rotation of the ribs. 1 means mild deformity or mild rotation, and 2 means severe asymmetry of the hemithorax. Third is a scapular asymmetry, means the protrusion of one scapula more than the other. 1 is a mild, and 2 is severe asymmetry. Last one is the waist asymmetry. 1 is mild asymmetry, and 4 is very severe asymmetry of the waist. So we calculate the 4 segments, and then we got out of 12, a number out of 12, and this is indicated how aesthetically or cosmetically affected. So from a radiological point of view, we use the COPS angle to measure scoliosis. From the horizontal plane, clinically we use a scoliometer to measure rotation of vertebrae or measure the hump. 5 degrees or less is not considerable, but a degree of rotation more than 5 degrees should be considered for treatment. On radiological point of view, the rotation, we use the Nash and Mui method. We divided the vertebrae into 6 segments. Pedicles of the vertebrae should be on the lateral 2 segments. So this means normal rotation of the vertebrae or normal alignment. Then if one is shifted toward the midline and the other starts to disappear, we give grade 1. When it moves further towards the midline, we give 2, and the other one disappears. 3 means one pedicle is on the midline and the other on the other side. 4 means severe rotation because one pedicle crossed already the midline. As we can see on the X-ray, we have the cervical and first thoracic vertebrae, the 2 pedicles appears apparently, but when we see on the apex, one pedicle only appears and the other disappears, means a significant rotation here. Okay, we have according to shape, we know a classification according to the frontal plane, which is C scoliosis and S scoliosis. But according to rotation, we have two types, a 3-curve and 4 curves. What is the difference? It differs a lot in treatment of these cases. So if we have a right thoracic curve, which means a rotation of the thoracic vertebrae toward the right, and if we have a left lumbar scoliosis, means rotation of the lumbar vertebrae towards the left. This is already we know. But what we should consider is that the shoulder rotates against the thoracic. So if the thoracic is rotated towards the right side, the shoulder rotated toward the left side. And lumbar is rotated toward the left side. This is a 3-curve. And the pelvis rotate with the lumbar. This is the 3-curve. But if we have a 4-curve, means that when we have a left lumbar scoliosis, and which means left rotation of the lumbar vertebrae, the pelvis will not combine with this, and the pelvis will rotate against. This is a 4-curve scoliosis. This is important in treatment, as we all, if we have a rotation of the vertebrae towards the right, we all treat this patient by moving the right thoracic, pushing it forward. But we leave the shoulder, which is supposed to be lifted, turn it to the other side, so we have to move it backward. We rotate the thoracic forward, but the shoulder should be backward. Okay? Same with the lumbar. If we have a 3-curve, the pelvis is rotated with the lumbar. We can move it forward, but if it's not, then we have to rotate the pelvis against the lumbar vertebrae. Okay. Before we go for treatment, we have to know the Reiser sign, which indicates the risk of progression, and to know where are we. This is a ossification of the iliac apophysis. Grade 1 means 25%. Grade 2 means 55% of ossification. Grade 3 means 75% of ossification. And grade 4 means 100% of ossification. And grade 5 means complete fusion of the epiphysis. We can see it also in the radiograph. This is the apophysis, and we check the black line between the iliac crest and the apophysis, and here there is a complete fusion. Grade 5, it means that we have a complete bone growth, and this patient is not going to grow more. Okay, now we are going to treatment. We follow the guidelines of the Society of Scoliosis Orthopedic Rehabilitation Treatment, or SOSORT, which they advise using physiotherapy scoliosis specific exercises, or PSSE. The aims of these exercises is to prevent progression, reduce the corpse angle, improve the quality of life, improve the aesthetics or the cosmetics of the patient, pain reduction, improvement of the vital capacity and chest expansion, and training of activities of daily living. So the indications of these exercises: for corpse angle less than 25 degrees with Reiser sign from 0 to 3, degree of 20 to 29 degrees of corpse angle with risk of progression from 40 to 60%. Adolescent with corpse angle with less than 35 degrees but Reiser sign from 4 to 5 degrees. Adults with painful scoliosis, and adults or patients refusing surgery. So this is just for the exercises, but we can use it with brace if the corpse angle from 25 to 40 or 45 degrees with Reiser sign from 0 to 3. And after spinal surgery or spinal fusion, we can use it, but this is another modified program of exercises. Okay, as you can see, risk of progression. Okay, risk of progression we can calculate it by using COPS angle minus 3 multiplied by Reiter sign and divided by chronological age. We can know the risk of progression. So as we can see in this table, less than 20 degrees of COPS angle with over age of 16, there is no risk of progression. While a degree of more than 60 degrees at age of 10 to 12 years, it means 100% risk progression, which means that whatever physiotherapy you are doing, these patients are going to deteriorate. Okay, exercises are divided into activities of daily livings with sitting and standing and walking, and you have to develop and train patients to use lumbar lordosis and thoracic kyphosis during walking, during sitting, or during standing, because it's the main reason that why he developed scoliosis, because the absence of the normal curvatures of the spine, thoracic and lumbar curves. So active 3D correction. Active 3D correction we use if you have a right thoracic curve, we just use it for left lateral shift. We'll use left lateral shift of the trunk. And we use, as we said, the rotation of the thoracic. If we have right thoracic curve, the rotation of the thoracic vertebrae or chest forward and the shoulder using it backward. The alignment of the legs is according to the pelvis orientation, whether it's a 3 curve with the lumbar curvature or is it 4 curve against the lumbar curvature. Last, we use the rotational angular breathing. Rotational angular breathing means that when we have a thoracic curvature, we have a lung depressed and compressed. So we use a breathing exercise that encourage from one side, the concave side. This side, we move it laterally to correct from the frontal plane, backward to correct the rotation, and upward to gain some kyphosis. Okay? And of course, it needs treatment, training many times. For those who indicated the brace, Susort advised to use Shinu or 3D brace and not the regular Boston brace that we already know. We should use the 3D brace. Thank you.